Welcome to Newswise Live Expert Spotlight. I'm Tom Canalicchio, here today with Dr. Eyal Talor, the Chief Scientific Officer of CEL-SCI Corporation. He's here to talk with us today about multi-kind cancer immunotherapy treatment being developed at his company. Dr. Talor, welcome.
Thank you.
Tell us a little bit about head and neck cancer, providing a little bit of an overview so we can understand how this new treatment may work.
Certainly. Head and neck cancer is a cancer of the area of the head and the neck, and it includes the floor of the mouth, the throat, the tongue, cheek, vocal box, and any other structure in this area. Mind you, it does not include the brain. About 90% of all of these cancers are squamous cell in origin, and therefore this cancer is classified as squamous cell carcinoma of the head and neck. About 6% of all cancers are head and neck cancers worldwide. It translates to about 650,000 patients newly diagnosed with this disease worldwide. And out of those, about 2/3 or 66% of head and neck cancer patients are diagnosed with advanced disease. It's very unfortunate. This is stage 3 or 4 disease, which makes their prognosis much worse than those with early stage disease.
And how are these cancers treated today, and how as well are those treatments tolerated by the patient?
Yes. There is a standard of care treatment for this disease, which is delineated by the National Comprehensive Cancer Network, or what is also called the NCCN guidelines. The treatment is surgery followed by radiotherapy, and for those patients who are deemed to have a higher chance for recurrence, they get chemoradiotherapy. Unfortunately, chemoradiotherapy is a very toxic treatment regimen, and some of these patients will not be able to tolerate that high level of toxicity. In general, patients will not be able to complete treatment, even if they just got surgery and radiotherapy, because of the toxicity of these combined treatments. Surgery itself is very disfiguring in this disease and has both short and long-term sequelae, resulting with difficulties in talking, swallowing, eating, and drinking. So it's a pretty bad disease from the patient perspective point of view, and the current treatment is rather awful, although helps some patients to survive. Some patients will also experience a lifelong dry mouth. That is related usually to the radiotherapy, which affects negatively the salivary gland, of course, in this area.
Do you think there should be a shift in how these cancers are treated?
Well, I think many people think that, but let me give you a little bit of a background. You know, there has not been a significant improvement in a treatment outcome of these patients, their 3 to 5 year overall survival, in over 50 or 60 years. While head and neck cancer patients in early stage have about a 50% overall survival at 3 to 5 years, the advanced stage disease patients, as you recall, most of them come in advanced disease stage, only have about a 30% overall survival rate. And therefore, despite all of the advances in medicine that we've had in the last 50 or 60 years, these patients have not really benefited much, and therefore this disease qualifies as an unmet medical need. We at CEL-SCI have been advocating to use the power of the immune system to fight cancer for over 20 years now, and for that length of time we've been developing multi-kind.
And how does multi-kind work as a immunotherapy treatment to harness the patient's immune system against the cancer?
The very short answer is that multi-kind's role is to teach the patient's own immune system to recognize and destroy their own tumor. A little bit more complicated than that. Multi-kind, which is, by the way, also known as leukocyte interleukin injection, is an investigational immunotherapy for cancer. And it is derived from the culture of the white blood cells, which are obtained from normal, healthy US blood donors. donating blood for transfusion. These immune cells are stimulated in culture, secrete cytokines, which are then purified, vialed aseptically, and stored frozen for future need by any cancer patient. And multikine contains multiple cytokines, which is they are proteins, which is what is unique about multikine. These are components that both activate and drive immune response in humans. And our understanding of multikine's mechanism of action has actually been published previously, some years back, in the Journal of Clinical Oncology. And in brief, multikine has multiple cytokine components in it, some which directly kill tumor cells, availing and exposing tumor antigens. These are tumor unique proteins to which the immune response can mount a good response. Others mobilize dendritic cells. These are the most efficient antigen presenting cells the immune system has, in order to go to the local lymph nodes where they can then present these antigens and interact with T cells, which come from the periphery, from the blood to these lymph nodes, in order to be able to create a specific anti-tumor immune response. Yet other cytokines in multikine increase and multiply these now committed anti-tumor T cells, as well as other immune cells. And finally, other cytokines in multikine bring these cells, these anti-tumor specific immune cells, back to home to the tumor, so they can now recognize and kill the tumor cells. And it's a little bit complicated, but this is how multikine works.
Great. Well, thank you for describing how it works. Tell us now about the trials involving multikine. What's the progress on that?
Yes, we are testing multikine now in head and neck cancer in 24 countries around the world, in North America, in Europe, in Asia Pacific, as well as the Far East. And currently we have over 660 patients that have been enrolled and treated globally in this phase 3 study.
So describe how multikine will improve the lives and the clinical outcome for these patients.
Of course, multikine will have to be proven to be right first in its ability to do so. But once this is the phase 3 is done and multikine is proven successful, it will likely be a treatment that will provide, one, less toxicity in comparison to the current standard of care treatment for head and neck cancer. Two, it should and will likely improve the quality of life of these patients. Three, it should reduce the recurrence rate in head and neck cancer, something we have not discussed. Head and neck cancers that recur have very poor survival prognosis. And last, it should increase the overall survival, of course, with improved quality of life, which is very important of these patients.
Where can people find out more information about multikine and these trials?
There are two main places where one could look for this information. One would be on a CEL-SCI website. That will be www.cel-sci.com. And the other would be www.clinicaltrials.gov and search under the term multikine.
Excellent. Thank you very much, Dr. Talor. Dr. Eyal Talor, the Chief Scientific Officer for CEL-SCI Corporation, telling us a little bit more about multikine and new cancer immunotherapy treatment. Thank you, Doctor.
Thank you very much.